Teenage pregnancy remains a serious concern in South Africa. In Mpumalanga alone, more than 8,500 teenage pregnancies were reported in this year, while other provinces are also reporting concerning numbers among very young girls. Dr. Wisani Makomesani, a board member of the South African Society of Psychiatrists, joins us to unpack the mental health impact of teenage pregnancy, what support young mothers need, and how we can better protect teenagers in the first place. Goeiemorgen, good morning, and thank you so much for joining us, Doctor.
Morning, Elsa. How are you?
I'm okay, thanks. I would like to ask, why is the rate of teenage pregnancy so concerning?
I think it's multifactorial, but the biggest issue is that these are growing brains. These are children that still need to be nurtured. These are children that are still growing, and possibly maybe the sex education for both boys and girls is not adequate, and so they find themselves in situations that they shouldn't.
Now, it seems as though we are not only talking about teenagers anymore, but children as well. I recently read that in the Eastern Cape, 66 girls between the ages of 10 and 14 gave birth in public hospitals only in the first 3 months of 2026.
Yes, it's actually, I'm going to say it's alarming. It seems as if the numbers are going down, but it's actually quite scary if you think that a 10-year-old is actually rape. I think with our sex education, we are not teaching our children to understand consent, to say, when are you able to say yes? When are you able to say no? The other problem is that those numbers only show what happens in the public sector. So we do not know with the miscarriages, we do not know what is happening in the private sector. So actually, it's more alarming than it seems.
And when we talk about preventing teenage and child pregnancy, what does protecting teenagers actually look like in practice?
I believe we should start in the homes. I think as parents, we need to start talking to both our girls and boys more. Them understanding the difference between what the body feels and what the mind thinks. Teenagers are growing and they do not quite understand what is happening to their bodies, most of them, and they believe that they should react to what the body is saying. I think that is important, but also in our schools, we need to go back to, the grade 4s or so, because 10-year-olds are in grade 4. We need to go back to early primary school to actually teach sex education, to say this is allowed, this is not allowed, a person should do this to you, a person should not do this to you. I don't think we're failing per se. I just feel that we need to realize how alarming it is, because we don't talk about it as much. And that's why I'm thankful that we have programs such as Good Morning Kyomore, where we're able to say to the parents that it is happening out there. Children are having children. But I think also we need to go back to the adults, because that says the adults are raping children. We need to go to the adults to say, these are children and children should be protected. Children are not able to consent. Half of the time, they do not understand what they're saying.
And awareness is very important within this regard as well, but maybe we'll get to that a little bit later. Access to healthcare is another important part of this conversation. What barriers are there?
I think first and foremost, it's shame. Teenagers who some are of age to can legally engage in intimate relationships are afraid to go to the clinics. When you enter a clinic and you're 17 years old or 18 years old, there is limited access to contraceptions. Teenagers will get there and they'll fear saying why they are there. Even boys will go there and fear saying, I would like to get condoms. So there is a limited access to contraceptions on top of the limited education. And I think that has been contributing quite significantly to that.
Now, research shows that teenage mothers can be at greater risk of depression and other mental health challenges. Why are they particularly vulnerable, and what warning signs should families look out for?
I think first and foremost, most teenagers, because it's unplanned pregnancy, they will miss that they are pregnant, which means that they will start antenatal classes late. they will live with the shame or the fear of parents or other people finding out that they are pregnant. Now, in South Africa, we generally say 1 in 3 women will have some form of mental health in pregnancy or post-delivery. But that will be in women that actually wanted these kids, women that are in a state where they can look after the kids. Now, with all the pressures on the teenagers, including the mind and the brain that is not matured, that actually increases that by almost 50%, which means that they are at risk and we need to support them more. Yes, they made mistakes. Yes, this was not planned. But I think as a community, we need to come to say this has happened. How do we make sure that both the pregnant girl and the baby are safe?
Absolutely. Pregnancy is already a huge life change for an adult. What makes it so difficult for someone who is in actual fact also still a child?
Yes, I think we have physical difficulties and mental difficulties. Physically, this person is still growing. This person is a child. They still need their mommy and daddy. And now they suddenly have to move and shift to being a mommy or a daddy. Also, with teenage girls, you find that they are rejected or the pregnancy is not accepted by the father of the baby. So they are isolated. There's a lot of shame. Sometimes it's even difficult for them to inform the parents that there is, and that also puts them at risk of backstreet abortions or, all this form of things that they'll try to do to get rid of the pregnancy, which also, like I say, we only know of the kids that delivered in the public sector, but we don't know how many lost their lives trying to lose the pregnancy. We don't know how many actually miscarried. And I think that also adds to the pressure for them falling pregnant as children.
At what point does teenage and child pregnancy become an indication that these children may need protection from abuse or exploitation? And what should adults be looking out for?
I think first and foremost, I'm not going to say mothers, I'm going to say parents need to know their kids. We need to see when your child changes, when your child stops being the playy, laughy child that you know. We need to look out for those warning signs: depression, anxiety, them isolating, them being sad, or not coming home on time. We need to work, sometimes we'll say teenagers isolate, but I think we need to work harder to reach out to our teenagers, to talk to them, sit down and talk to them and say, this is what is happening in the world. How can we help? We need to say that, yes, I do not want you to fall pregnant, but when you are pregnant, you're still my child. I still love you, and I'm willing to support you throughout this whole process.
Now, if we wanted to seriously reduce these numbers over the next few years, what would a proper support system look like?
I think education, education, and education. Our public and private services, when a teenager comes in, sex education, even from the health staff, that has to be part of every consultation for girls. It seems as if we have to start as early as 10 years, even if they say, no, I'm not engaging in that. I think information, they have to know about it so they're able to consent and they're able to say, no, I'm not going to engage in that. I think support. And the media is currently helping, and this information will go out there, and thankfully they will know what to do and what not to do. And this includes the boys.
Absolutely. We've got about a minute left, but I would like to ask you, how would you describe the importance of awareness and what more can be done?
Awareness is getting the information out there, whether it's social media, whether it's media platforms such as this, whether it's talking at the home, the churches, the schools. The kids need to know, Sunday school, there has to be part of Sunday school, for example, where we actually make it aware. We make the boys and the girls know that when you do this, this is at risk, but also understand what they are doing. So awareness through all the platforms. Most of the kids now have a phone, and they are on social media somewhere. Let us talk about it. Let us get it out there.
But thank you so much. Dis dan al vir daai gesprek. Bly ingeskakel, ons is nou weer terug.